A very good evening to all of you. This is Dr. Manisha. I'm a medical lead for Medical Affairs Division of UPenn. On behalf of my division, I welcome you all in this brief discussion on patient awareness of related to PCOS and the mental conditions. As we are aware that women are vulnerable to mental health conditions, and this is quite a common problem with the women in the age group of starting from teenagers to old age. So basically, they are very prone for mental condition and psychiatric illnesses. So here, joining with me is Dr. Neha Salandar, who is a very well renowned psychiatrist working in Nagpur area in Maharashtra. So here we'll go ahead with the panel discussion. Welcome, ma'am.
Good evening, Dr. Manisha, and thank you, Team Lupin, for having me.
Great, great. So here we'll start the discussion. So as we all aware that PCOS or what you can say is very common gynecological condition, and it is becoming more and more common in women, particularly in adolescent age group, teenager girls, and even middle-aged women. So there is increasing evidence of this condition, especially in Indian settings, because of a variety of multiple factors involved into it. So, what are commonly observed psychiatric disorders in women with PCOS, ma'am?
Right. So, like you rightly said, PCOS or PCOD is fairly common. The statistics are that it affects nearly 1 in 5 young females, which is a big number, nearly 20%. And why we are talking about it, why I, as a mental health professional, am talking about PCOD, because there is a lot of data which says that there is increased prevalence of not just mild emotional disturbances, but frank syndromes like depression or anxiety or even panic disorder in females who are suffering from polycystic ovarian syndrome.
Yes. So, do you feel that this type subset of patients are very common, especially in Indian patient as compared to Western population?
Yeah, there is a rise in the number of patients who are suffering from both the things together. So, for example, statistics say that when we compare women of same age group with and without PCOD, women with PCOD display depression up to 27 to 50%, as compared to nearly 19% of women without PCOD. So the numbers are like almost in the range of double or even more than double, right? So the presence of PCOD is almost doubling the incidence of depression in young females, which is a significant number.
Yes, so really the condition is really very alarming and very difficult to handle as well. So as per some studies, if you see that the prevalence of the anxiety and depression was reported in women with this PCOD,
Yeah.
this indicates that there is also increasing need of mental health experts as far as patients are concerned, because sometimes what happens, patient may not be aware of this. So, what is your take on it? Means how such subset of patients who are actually not aware, how we can actually counsel them for the mental condition awareness.
Right. So for that, first, I would just like to mention what are the symptoms of depression and what are the symptoms of anxiety. Because a lot of times it happens that the patient is experiencing these symptoms, but they don't know that it is an illness or they are not able to put a name to it. So in depression, a patient suffering from depression would mostly feel low, feel sad, feel unhappy without any major reason. They are not able to come out of it despite them or their family members trying really hard. There's a loss of enthusiasm, loss of motivation or energy. They feel fatigued and tired most of the times. They're not able to concentrate in work, studies. There might be disturbances in sleep or appetite. Mostly there's a loss of appetite or sleep, but it could also be an increase in either of these two. There could be weight fluctuations. The confidence drastically reduces, sense of worthlessness or low self-esteem come in. In very severe cases, the patient might experience suicidal ideas and thoughts also. And symptoms of anxiety would look like feeling uneasy, restless, not being able to relax, feeling very high strung, being worried all the time, having negative thoughts in your head. There could be
Mm.
frank panic attacks or milder bouts of anxiety. So these are symptoms which can commonly occur in patients who are suffering from PCOD. So, if you are experiencing these symptoms in yourself or in any near and dear ones, then it is worthwhile to seek the help of a doctor. So if you're already seeing a gynecologist for PCOD, your first point of contact could be that doctor. If it's milder symptoms, they might be able to help you out. But if it's something which is more severe, then you can always consult a mental health professional for the same.
Yeah, absolutely true. Yeah, and you might have come across such many subset of females who are having such kind of thing. Like I would say, females are actually predominantly affected with such kind of aspects because of cultural, environmental, social, multiple factors are involved
True.
into it. So
True.
it's really, really very serious. But the unawareness about this fact is also very high. That is more worrisome,
Yes.
right?
Yeah.
Right. Okay. So this is one thing I would like to know, and also, what is your final message to come out of this all discussion? Means thank you for sharing such valuable information. But in a
Thank you.
short, like, how would you like to conclude this entire conversation so that we can actually get to our patients?
Yeah. So I think the first and most important thing is to be able to identify that you're suffering from these issues. And
Mhm.
second, if you are suffering from this, don't hesitate to ask for help. There's a lot of, stigma or misconception that if you go to a psychiatrist, they'll put you on sleeping medications, or once you start their medicines, you'll never be able to stop them. And such is not the case at all. Depending on what problems the patient is suffering from, if there's some dietary changes that we can make to, in this case, maybe counter insulin resistance, we do that. We suggest other lifestyle modifications. We can suggest counseling or talking therapy. There's different types of psychotherapy techniques like CBT or interpersonal therapy or group therapy. Support groups are a great way to kind of help patient through with these symptoms. And then lastly, if all of these things don't seem to work, then we can offer the patient the option of medications. So don't hesitate to ask for help, don't hesitate to seek treatment, because this is something which can very easily be taken care of, and if not taken care of, can greatly impact your quality of life, your output in work, academics, and everything. So learn to recognize the symptoms, and don't hesitate to seek help.
Very well said, ma'am. Very well said. Great, Dr. Neha. It is really very great to have you here and sharing these important insights, which are actually quite, we can relate around us, the people around us. So, thank you for sharing all these valuable thoughts with us. So, with this, I would like to conclude the session. Thank
Thank
you
you.
so
Thank you
much.
so much for having me. Thanks a lot.
Thanks a lot.